Alright, so we're here with Nani. She has some upper back, neck discomfort, mostly from hunching, looking down at a phone. She works on her phone. You work on your phone as an artist?
Yep.
So she's concerned about her posture, her standing posture, standing slouched, and medical history is clean, never previous x-rays, no prior visits to a chiropractor. One diagnosis of a tilted pelvis in college. That was actually a tilted uterus, but that's been asymptomatic. And other than that, there's no pharmaceuticals being taken right now. We do have some supplementation happening, and this is her first chiropractic adjustment ever.
Ooh.
All right, very good. Okay, stand up nice and tall. Let your arms relax. Good. All right, first we're going to look at some postural stuff here. A little bit of a high left shoulder. Not too bad, though. Not too much of a lean. All right, go ahead and close your eyes now. I'm looking for postural sway here. So which way you sway. If you sway forward and backwards, a little bit of forward, right. Forward and backward indicates a fixation in your pelvis. Side swaying indicates a instability in the SI joint. Pretty steady though. You have a nice sense of balance there. It's mostly just that forward rock there. Very gentle, very subtle. Okay, that's good. You can open your eyes. All right, turn around, face the other way. Okay, very good. Okay, let your arms relax. All right, so checking the bottom tip of the scapula, so we do have a high left shoulder. I'm going to look at the ear height for mastoid process. I can't really see it from there. Where your ears at, yo? Here they are. Here, turn around and face me again. High left shoulder and high left mastoid. You can turn around and face the other way again. Mm-hmm. Good. Okay, I'm going to look at your pelvic torque here. We're going to see if there's any tilting there. Mm-hmm. All right, you're going to feel my fingers on the back of your hamstrings like this, tracing up to the bottom of the glute fold. It's lower on the right. That means your right hip is back like this. Mm-hmm. And looking from the top, they're even, so there's no internal or external rotations. Mm-hmm. Oh, yeah, your thoracic, your lumbar curve here is significant. So, mm-hmm. So this is that tilted pelvis that she was talking about. It's not terrible. You still do have some curve retained here in your thoracic spine. Usually this flattens out when you have, it's not quite sway back in hyperlordosis. Can I just lift up your shirt a little bit?
Of course, yeah.
All right. Okay, let your arms relax. All right, it's not terrible. Go ahead and turn to the side so I'm just looking at it on the camera. Good, not terrible here, but definitely an increase in the lordosis. All right, but let's just see. That might be normal for you. Go ahead and have a seat on the table. Do you work out or anything?
No.
I mean, like your back is very stiff then. Yeah. All right, I'm gonna do some palpation of the sacrum, okay? Mm-hmm. All right, let's see. Right, left. Is one of these more tender than the other? Or same?
The right.
Right. Okay.
Wait, more tender, like as in a little more tense or pain?
Yes.
Yeah, this side a little.
Okay, we're going down to the lower SI joint here. How about here, right or left?
Right still.
Just not too much though.
Yeah.
Okay, that's good. Let's do this now. Turn to the left. Good. Any tension, discomfort here? Ready? Let's compare this. Mm-hmm. Turn to the right. To this. Any discomfort or tension?
This feels a lot. I can do this easier than tilt. Yeah.
Bring your chin down to your chest. Mm-hmm. All right, let's do this. Bring this back up. Go. Bring your ear down to your shoulder. Let's do this side here. Bring your ear down to your shoulder. Which side's easier for you?
This side.
Which side?
This side's
easier here. Mm-hmm. Feel tension here.
Or like right in this.
Okay, that's okay. That's just muscle stuff.
Yeah.
But it is upper cervical right. Tender. Okay, is it this? Is that tender?
Yeah.
Or is it behind that, under there?
That.
First one or second?
That second one feels more accurate. There's still some pull here.
Mm-hmm.
Yeah.
Okay, that's good. All right, I'm going to push down on top of your head.
Okay.
Do you have any pain, discomfort, tension when I push here? Tension?
None.
Okay, I'm going to lift up your head. Any pain, discomfort, tension there?
Mm-mm.
Okay, good. Does it feel good when I lift it up?
Yeah.
All right, good. Then you're gonna love that adjustment over there. Okay, nice, gentle breathing. Ready? 1, 2, 3. Which is one more tender. 1, 2, 3.
Can you do that again?
1, 2, 3.
3.
Ready? Compare that to 4, 5, 6.
4.
This side right there, right?
Yeah.
All right, so we have the fourth trap fiber. We're working on that. Let's see what your pelvis says. I know that it's all your upper back and neck, and your pelvis matters too. Everything's connected. Okay, I'm gonna bend your knees here. Try not to help me. Just let it go. Short crosses over. All right, that's good. A couple more things here. All right, let's do this. Go ahead and lift this leg up in the air. Good, down, 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 down. Whole thing, lift the whole thing up.
Oh.
Good, down. Good, left. Down. Okay, do the right again. Down. Left. Down. It's one more difficult than the other.
The left side tends to is a little more strenuous.
All right, if I go like this and push down onto your hips, lift your right leg up, and then left leg up. Is the strain the same? Still there, more or less?
The strain is for the left side. It almost felt like the right side was a little bit more strenuous that time.
Okay, very good. Thanks for that. That's helpful. Okay, ready? Discomfort, tension here.
No, nothing.
Here.
Discomfort.
Okay. All right, let this relax here. All right, so we're going to adjust at the fourth trap fiber, so we need to adjust T6, good, and L2. Those are two primaries. We have to adjust up here too. But first, let's loosen it up. Let's get loose. All right, we're going to do some pushing here, okay, Noni?
Okay.
All right, so let's practice it first so you can feel what it's like. You're going to take a deep breath in. Good, and out. I'm going to follow your breath like this. At the end of your breath, I just follow right to the end, and then we push like that, okay?
Okay.
Okay, it's a little tight in here, but I'm going to do very gentle at first. If we have to push harder, we'll go back for it, but we're going to start right there. All right, deep breath in and out. Good. Shoulders relaxing here. Very nice. Gentle, gentle, gentle. That was nice, right?
That was amazing. Holy crap.
All right, now the next one that we have to adjust is down here, but first we're just going to take care of some, this is all compensation here. Nothing too crazy, but we're going to not leave anything on the table. So let's try again. Deep breath in, all the way in. Not bad. Good. Same thing, following your breath. Shoulders relax as you breathe out. Good. Very nice. Good.
Happy camper?
Okay, not bad. Yeah, I'm still left short. Just a little left short. All right, I'm going to look at the top of your gluteal cleft, okay? I just want to see which way. There's a test that shows me which way your sacrum is curving. Or just to the right. Okay, I'm going to test your coccyx, okay? This is the very bottom, the tailbone. Is that tender right there?
Just a little bit, yeah.
Is that tender over here? It's more on this side, right? All right, so take a deep breath in. I'm just going to hold this tension here while you let the shoulders relax. That's good. Good. Very good. That just takes a minute. It's tense up here too, right, in your head. 1, 2, 3, 4. Okay, this is that same fiber before. Is this tender still? Is this better? Same? Worse?
It's actually better there.
That's better. We still need to adjust this L2 though. All right, let's see. Right or left? Right, left, right, left.
Right.
What about here? Right, left, right, left.
Oh, right.
Okay, and what about here? L2 is C6, C4, C4. Right or left?
Right.
Because that means this has gone to the right, PR. So when you adjust this on laying on your left side, okay, your head's relaxed right there. You doing okay?
Mm-hmm.
All right. So first I'm going to adjust your lumbar spine here. Mm-hmm. So you're going to breathe, and as you breathe out, I'm going to stretch your shoulders up like this and your hips down like this, and then we push like that. Okay. Okay. I do that again. Deep breath in and out. Good. Shoulders relaxing. Good. One more. Lay on your back. Ready for this one? Mm-hmm. Okay, deep breath in here. Good, and out. Good, we're gonna bring the hip down, just gentle, 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 gentle. Shoulders relaxing. Good, you're doing good. Another breath. We'll follow this breath out. Good, lay on your back. Nice.
That was good.
All right, let's do this. Now, you go and turn your head to the right.
If I know where my right is, yep.
Back to center. Now left. Center. Bring your right ear down to your shoulder. Center. Left ear. Center. Okay, one more time. Turn to the right. Center. Turn to the left. Center. You lefty or righty?
Right.
Okay. All right. Let's see. I'm going to adjust the left side first. First, we'll do a little traction here. Okay, your mudra?
A mudra?
Yeah, your fingers right now.
Yep. Is that what I'm doing? That's hilarious. Yep.
Yeah, it's not a mudra. It's your hand. It's a hand posture, basically.
Oh.
They all have different mudras have different ways of transferring energy. There's like different intentions with different.
I figured so.
It all depends on the culture too. The Zen Buddhists have a whole bunch of different ones than the Ayurvedic people do.
Mm-hmm. Mm-hmm. True. Now the neck adjustment is just like the other adjustments. It's gonna be nice and gentle. It doesn't hurt. Do you crack your own neck ever?
Mm-mm.
Okay.
And I don't mess with anything like that.
Cool. Nice and gentle breathing. I'm gonna bring your head over to the side like this right here. Gentle, 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 gentle. I'm gonna move in that direction like that, and I'm just gonna push like that. Okay, good? All right, nice gentle breathing. Good. Sinking in.
Wow.
All right, that was pretty good.
Time will needed to happen.
Yeah. I felt that in my skull.
It went up?
Yeah, I could hear it. It was good.
Interesting. Okay, I'm gonna check to make sure I got it all. I know that there's one more left at the bottom. Didn't quite go all the way. I have to go down one segment just to get the rest here.
Oh. Oh.
That's nice, right?
That's amazing.
Nice and gentle here. I'm gonna push in that direction like that.
Oh. That was awesome.
Cool. This is just like the other adjustments. It's gonna follow your breath. It's slightly more aggressive. All right, nice and gentle breathing, good. And as you breathe out, we're gonna follow the breath like this in this direction and give a pull in that direction at the end, okay? Okay, let's give it a try. Good, teeth together. Keep your teeth together. That's good.
What the heck?
All right, put your hands on your hips. Good, and then push your elbow back against my hand here. Push your elbow back. Oh, there it goes already. It's fine. Good, push this elbow back now. There it goes.
Oh, I felt that.
That's good. All right, bring your chin down to your chest. Good, we're gonna go like this. Hold on like this. Let the shoulders relax. Good. And this one up here like this. Good. Good. Let it relax. Bring your head up. Good. Little gentle. Good. Okay, so right now we just like unleashed all of this. We restored all the range of motion by releasing all the fixation. So right now your proprioception, or your body's awareness of itself, your brain's ability to control your body, is like times 10.
Word.
So what we do is now we use this moment where your nervous system is like in this like
State, yeah.
very influential state or suggestible state. And we go like this, squeeze your shoulder blades back together. Good, and then look up at the ceiling. Good, we had a high left shoulder, so we come back down this way just a little bit. Good, this way. There we go. And we stimulate the cervical spine again at the very top. And down the thoracic spine. This creates muscle memory. This is neural patterning. Trying to help your body maintain this position more easily. Everyone slouches eventually. Everyone gets tired. Your posture muscles get tired. But the more that you practice, the easier it is. How'd that feel?
So good.
Okay, good. How's
Reset
neck?
the spindle
Move the neck around like
fibers.
this.
Oh. Wow. Huh.
Good.
Cool.
All right, anything else? Do you have any questions?
No, I think that's pretty damn good.
Okay. The only thing that you have to do from here is drink lots of water, okay?
Oh, I will happily do that. I'm literally a little dehydrated now.
All right, very
I
good.
tried to drink as much water before I came in too.
All right, good. Okay, water's going to be very helpful right now. You are already very advanced in your yogic meditative ways, and I can only encourage those more. The more that you do that, the less you'll need me. The more you pay attention to your posture, the less you'll need me or any doctor.
Noted.
Yeah. You know what it feels like to be adjusted. You don't have anything crazy acute to work on, so like we'll just let this go, and then you guys can come back when you need another one. Yeah.
Thank you so much for my first adjustment.
You're welcome.